All right, good afternoon, guys. I'm here for your afternoon session here from 1 to 2-ish, um, answering questions on the respiratory system. So that's what we're going to continue talking about for today. And if you have any questions about your project, today is the last session for that. So looks like I got somebody in here. If someone wants to say hello, wait for a few more people to join to get started for today. All right, right on the side bar. Good afternoon. All right, got a few people in here. All right, anybody want to say hello? How's your day going? I know it's a wet, rainy day today. It's been raining the last few days. I guess we've needed the rain. I think the rest of the week will be kind of nice, hopefully. We'll be talking about the respiratory system and going over some stuff for your project. All right, who we got here? I'm not too sure who this is. I got your hello. Can you state your name last to react? I don't know what your name is. I don't know if you're one of my students or Mr. Canaloo's students. Okay, if you have any questions before we get started here, I'm going to talk about the respiratory system. So if you want to say hello, I got your good afternoon there. All right, so I'm going to talk about the respiratory. Oh, okay. Hi, Val. How are you? Hopefully you're doing great. Good to see you in here. Do you have any questions, Val, about your project due Friday, along with the brain pop? Okay, Gus. Okay, I did recognize. Now I see your name. I didn't recognize your screen name. How you doing, Gus? Hopefully you're doing great too. You and Val are doing fine. You guys are in here at this moment right now on my live chat. So do you have any questions, either one of you guys, for the project due Friday on the respiratory system, drawing and labeling the parts? Okay, and then tell me what they do with the digestive system. I labeled about maybe nine vocabulary words with that. Okay, and then you could just draw and label them and what they do, and then tell me about a respiratory illness or disease, something that affects it. And I'm going to talk about some of those today. All right, so you could listen in on that. So I'll be going over a few of those. So if you don't have any questions, I'll go ahead and get started on the live feed with that. Okay, all right. Anything else? If you have any questions on organs, the lungs, the trachea, the pharynx, diaphragm, the bronchi, the alveoli. Those are some of the parts that we studied, and you could go back and listen to some of those if you missed out on that, and/or find them online. Okay. We're going to talk about respiratory illnesses and respiratory infections for today. Okay, let's see. Val. Okay, we got Jade and it looks like, or not Jade and Isabella. All right. Hi, Isabella. You're in here too. So no questions, Val. I'm about to finish the project. I didn't get anything yet, Val. So once it's finished, double check with me. Send me an email or a message on Teams that I got it. So I'm on my computer right now, but I don't think I have your project yet. So I did not get your respiratory system project yet. Okay. All right. So I'm going to continue talking about this. All right. So if you're just finishing it up. Okay. So yeah, you have all the time to send it to me. It's due Friday. So you have 2 days to get it to me. All right. So respiratory infections. All right. Infections of the respiratory system or respiratory tract can occur in the upper respiratory tract in your throat, and the lower respiratory tract, which is your lungs, okay, or both areas. So organisms capable of infecting the respiratory structures are bacteria, viruses, and fungi. Those are probably the three main that are going to affect your respiratory structures. So depending on the organism and the extent of the infection, symptoms can range from mild to severe and even life-threatening, depending on what they are. All right, so the respiratory tract is protected by a number of very effective defensive mechanisms. For example, to reach the lower respiratory system, like your lungs, the organism must be particularly virulent, meaning like a virus, okay, or very powerful. And it presents in very large numbers, or the host defense barriers must weaken. So factors that might weaken the respiratory defense barriers are cigarette smoking, okay, which can paralyze the cilia lining the cells and the passages, the respiratory passages, and the presence of respiratory pathogens such as a cold or influenza as well. Okay, so those are some things that might have an effect with it. All right, any questions in here? We got Jennifer. Hi, Jennifer, as well. All right, guys, make sure you're asking questions in science, not talking to one another here. Okay, so Jen and Val. All right, same with you guys. All right, like I was saying, make sure you are partaking with what, if you have questions, this is for you to ask me, not talk with a friend. Okay, all right. So hopefully you understand that, guys. All right, so make sure you need to chat with me, not the teacher. Okay, all right. So the common cold. The most common viral pathogens are the common cold. All right. They enter through the body of mucous membranes of the nose and eyes, and they readily spread from person to person through respiratory secretions. So it's a manifestations of a common cold. How to get it are through the nose, inflammation of the nose, nasal mucosa, the sinuses as well. Okay, the throat, the pharynx, headache as well. All right, nasal discharge and congestion. Those are some things of the common cold. Okay, common cold is considered an upper respiratory tract infection. So symptoms of the flu, okay, they're a little bit different than the common cold. Headache, fever, chills, muscle aches is one of the big ones with that one. Nasal discharge, unprotected cough, sore throat. Influenza is an infection that could caused by marked inflammation of the respiratory system. All right. As a result, infection may lead to the co-infection of the respiratory system of pathogens and bacteria, and it also could be influenza could lead to tissues and lungs itself, causing pneumonia, which we'll eventually get into that as well. Okay. All right. Looks like we got Chloe in here. Hi, Chloe. Hi, Kyle. We got you guys in here too as well. So thanks for participating. Ask any questions that you may have on the project. This is the time to ask about it. I'm talking about the respiratory illnesses and diseases. Okay, so make sure you are asking questions if you have any during this time. Now, the treatment of influenza, bed rest, fluids, warmth, antiviral drugs, influenza vaccines. All right, so these are some things that help prevent the flu or treat the flu. So protection against any type of influenza are expected usually depending on the year. It could be an A or B strand. There's a couple different strands of the flu. The vaccine must be updated and administered yearly to be effective. And the flu vaccine is advised for elderly people, so older people or younger people as well, and individuals with weakened immune systems as well. Okay. So there's some common differences between the flu and the cold. A fever is very rare in a cold, but it's very popular in a flu. Headache, very rare for a cold, very usual for the flu. Body aches are mild for a cold, but they're very severe for a flu. Weakness, mild for a cold, weaknesses can last up to 3 weeks with the flu. Extreme fatigue, meaning tired, is usually unusual in the cold, but very usual and common for a flu. Nasal congestion, you could have nasal congestions for both of those. So like blowing your nose. All right, sneezing is common for a cold, sometimes for a flu, not as common. Sore throat is usually common for both of them. Okay. All right. Any other questions that you may have? Okay, looks like Val has a question here. So what did she say? When do the disease part include medications? Yeah, you could include medications if there's medications for it. I put in on Microsoft Teams, Val, I did put, you could state what the disease does or what it is for your respiratory illness or disease. Tell me what it is, tell me the symptoms, and tell me the treatments, maybe how long somebody may have it, how long their life expectancy might be for it. So give me as much information as you can, but definitely talk about the treatments and symptoms. So treatments would be like kind of like medication. What are they going to do to get better from this? Okay, if they could get better from it. Okay, so hopefully you got that there. All right, asthma is a good one to do. Looks like you mentioned that. I'm going to be talking about asthma here real short here, so I'm actually talking about it right now. So what is asthma? Asthma is a chronic lung disease that obstructs your airflow from breathing. So the obstruction is reversible, okay, as well. And it involves difficulty breathing due to inflammation of swelling, mucus in the airways, tightening of the muscles around the airways as well. So it obstructs your airway. So it feels like somebody's kind of like choking on something. That's what some people may compare it to. Because some people can have an asthma attack where they can't get that air, they cannot breathe. But there's some certain types of substances that could trigger an asthma attack. Here's some of the substances that could trigger air pollutants, including dust, smoke, mist, fumes. Some of these examples could be smoke, tobacco smoke, minerals, rocks, coal, gases, vapors in the air. Another thing that could trigger an asthma attack, pollen, mites, and mold, okay, from our environment as well. So trees, flowers, weeds, hay, plants, they could cause an asthma attack. Animal dander, if you have pets at home, dander, the smell from them or some of the fur that they leave behind, birds, cats, dogs would be an example that might trigger an asthma attack with somebody. Even medications, someone might have a reaction to the medications they take. Aspirin, anti-inflammatory drugs could cause an asthma attack. And same with foods. Okay, foods can also, that someone eats could cause an asthma attack. Maybe they're allergic to eggs or wheats or nuts. This could be an example there. So symptoms of asthma, okay? All right, let's see. Is there any medications for asthma, or can you only use an inhaler? Inhaler is one of the main ones that people will use, Val, so good job with that. I'm going to talk about that here right now, so just pay attention. Symptoms of asthma, coughing, wheezing, which is like a whistling sound, shortness of breath, chest tightness, sneezing, and runny nose, itchy and inflamed eyes as well. Those could be some symptoms of asthma. All right, can asthma be cured? All right, asthma cannot be cured, but it can be controlled. Okay, so avoiding triggers or reducing exposure to triggers is one thing, or using medication to control those symptoms. All right, there's generally two types used: long-term drugs and quickly relief drugs. So taking prevalent excess production of mucus to reduce inflammation for the constriction of the airways and reduce or quick relief drugs, that would be to take to relax muscles around the airways to improve. So an inhaler would be one of the type of medications that we prescribe for quick relief. Okay, so that would be one that can be used for that, to relax his muscles to help breathe. But your question, I believe, says here, is there any medication for asthma? Can you only use an inhaler? Inhaler is one of them. Other ones are some other long-term drugs that you can't take for it too. Okay, so there's a couple different kinds. So what do you do if you have asthma? All right, identify and minimize the contact that with your asthma triggers, what could be triggering it. Understand and take asthma medications as prescribed. Recognize early signs that your asthma is getting worse, or know what to do when your asthma does get worse. Okay, like seeing a doctor. Okay, looks like we got a couple other questions here. We have one. It says, looks like Isabella, like nail polish. Yeah, a smell from nail polish is, it could be, that could set a trigger as well to cause an asthma attack as well. So what are the symptoms again? That's what Val's asking. I'll go back and I'll go through that there too. Symptoms of asthma: coughing, wheezing, which is like a whistling sound when someone wheezes. Okay. Shortness of breath, your chest becomes tight, sneezing, running nose, itchy and inflamed eyes. Those are some symptoms there. And you might find some other ones online from other online resources there too. Okay. All right. Excellent. All right, I'm going to go on to the next, and then it looks like Isabella wrote, or lotion that smells good. Yeah, some of the lotions could also have smells that can affect that way too. Good job. All right. Let's take a look at the next one here. The next type of illness, respiratory illness, I have one is called laryngitis. Okay. It causes a hoarse voice or complete loss of the voice because of irritation to the vocal cords. All right, so inflammation of the larynx. Remember we talked about the larynx, that's your voice box or your vocal cords. It causes hoarse voice to complete loss of the voice because of irritation to the vocal cords. So that's what affects it that way too. All right. Another type of respiratory illness is called bronchitis. All right. It's an inflammation of the main air passages to the lungs. Okay. Most prevalent in the winter, generally part of acute upper respiratory illness. It may develop after a common cold or other viral infections of the throat and bronchi, and it will often with secondary bacteria infections, so that will have some effect with that. So bronchitis, some signs and symptoms are chilliness, slight fever, back and muscle pain, sore throat, onset of distressing cough usually signals onset the bronchitis. Cough starts off dry and later produces mucus as well. So those are some signs and symptoms for that. Okay. Treatment. Treatment for bronchitis, the patient should rest until fever subsides. If you have a fever, drink plenty of fluids and liquids, and take fever reducers like aspirin or ibuprofen. Okay? All right. Any other questions that we have so far? Hopefully I've answered your questions there, Val. All right, very good. I'm going to continue on with some more respiratory diseases here and illnesses. Going on to the next one. Some of you guys might have had this one before. This one is called strep throat. I mean, how many of you guys have had strep throat? You can answer your answer in your sidebar there, live chat. So if you've had strep throat, let me know. It's a pretty painful one. Strep throat is another respiratory illness. Strep throat is a bacterial infection of tissues on the back of the throat of the tonsils, usually your tonsils way back in the back of your mouth. This tissue becomes irritated and inflamed, causing a sudden severe sore throat. Strep throat is caused by what they call streptococcal strep bacteria. So there are many different strains of strep bacteria, some of which cause more serious illnesses than others. So if you've had strep throat, looks like somebody have never had strep throat or the flu. Okay, that's great. You're ahead of your health there. So very good, Isabella. All right, so that's good that you haven't had any illnesses with strep. Okay. Yeah, strep throat you can be out of school for some time with strep throat. It lasts a couple weeks long if you have it. Okay, usually inflames your tonsils in the back of your throat there. Some other things that are common symptoms of strep throat: a sudden severe sore throat, pain or difficulty swallowing. It hurts when you swallow, so that's why liquids are very good to have. Soup is very good to have, but it still hurts. Usually have a fever over about 100 degrees. You get swollen tonsils and lymph nodes. You'll get white or yellow spots in the back of your bright red part of your throat for that, for strep throat. You'll get a headache possibly and abdominal pains with stomach aches. Strep can also cause red skin rash, vomiting, loss of appetite, and general feeling of discomfort and illness. Okay, so those could be some factors there. Strep throat is diagnosed with a physical examination, medical history, and a rapid strep test. So a throat culture is sometimes done to confirm the results of a rapid strep test. So strep will go away in usually about 7 to 10 days, usually about a week. It could last into a second week, possible too. However, strep throat was still treated with antibiotics, and even if to get a speedy recovery. So antibiotics basically kill strep bacteria. Something like maybe amoxicillin would be a type of antibiotic. Shorten the time that you're contagious and reduce complications as the infection spreads to other parts of your body. So your healthcare professionals, like your doctors, also recommend non-prescription drugs to relieve pain and discomfort and reduce fevers caused by the strep throat. Okay, so any questions on strep throat? All right, Chloe, it looks like she wrote, yeah, strep. Yeah, that many times? 5 times? That's a lot of times there, Chloe. So hopefully not. Okay, so that is pretty painful. I've had it a few times as a kid. So yes, it is painful. All right, my next respiratory illness I'm talking about, one I mentioned earlier to you guys, is pneumonia. It is most deadly infectious disease in the United States. Okay, it's the 6th leading cause of death. Now, pneumonia is a lower respiratory tract infection, meaning that affects your lungs. Remember, your lower respiratory tract, your lungs, your upper respiratory tract, the ones that we talked about, are your throat. So your common cold, your flu, your the one I just talked, strep throat. Those are upper respiratory. Now this one affects your lower respiratory system. So individuals most at risk for pneumonia are older people, elderly people, those with viral infections, they're chronically ill, smokers, and patients with chronic respiratory disease, such as bronchitis, bronchial asthma as well too, would be a factor as with that. Okay. Pneumonia occurs when bacteria or chemical irritants and viruses get into your lungs. Okay, so like streptococcus would be that. So pneumonia causes the alveoli in the lungs to fill with pus and other liquid, this thus causing difficulty in breathing. Okay, so that's what happens with that. Okay. All right. Any other questions so far on pneumonia as we continue on? Looks like we're close talking about strep throat. So yeah, you still looks like you had it 5 times. All right, and she said I can't get my tonsils out. Okay, so that might be something. If you have to get that down the line, your tonsils. Yeah, I'm glad you never had pneumonia before too, Val. I've had it as a kid, and it's pretty bad. I've had it probably a little older than you guys. I think I was in 7th or 8th grade when I had pneumonia. It makes you really tired, very weak. I was out of school for well over a month, so I'll still talk a little bit more about pneumonia right now. So your lungs fill up with this liquid from this pus, and it causes difficulty breathing. You just come real shortness of breath from it. Okay, I think I had a type called walking pneumonia, which is very similar. It's a little bit different than pneumonia, but I was just very tired from it. So inflammation or infection of the alveoli is in the lungs. So some symptoms are fever, bluish skin, difficulty breathing, increased pulse, mucus cough, and mental confusion. Okay, would be um, some types of symptoms for pneumonia. All right, continuing on for treatments, how you were treated. To treat pneumonia, a doctor would choose an antibiotic, like I mentioned before, mainly based on your health to see how serious pneumonia is. Amoxicillin, like I mentioned before, is an antibiotic medicine that's sometimes prescribed by doctors depending on how bad the pneumonia is. So if the pneumonia isn't that bad, the infection can be treated at home with other types of oral antibiotics as well too. So then drinking lots of fluid is another way to help pneumonia. So drinking your lots of liquids. Okay. All right. Any other questions so far on pneumonia or before I move on to the next one? Okay, excellent. All right, your next type of respiratory illness I'm talking about, these are ones I mentioned in your assignment. You can do or choose any of these, or you could choose one of your own, okay, by researching some. Emphysema is the next one I'm going to talk about. Emphysema is a chronic, long-lasting disease that gradually destroys the lungs. So this destruction means that you become unable to breathe in enough oxygen, and you have trouble breathing out carbon dioxide, okay? So this is another one that is going to affect your lungs. Now, the main difference is this one is as by someone that smokes. So we teaching you guys at a young age not to cigarette smoke because cigarette smoke could lead to diseases like this, along with lung cancer, and we're going to talk about how those could have serious effect on your body. So cigarette smoking is by far the most common reason that people develop emphysema. So, and it is it is also the most preventable cause too, because you can prevent from doing it. Other risk factors include air pollution, heredity, in your age as well for emphysema. Cigarette smoke contributes to this disease process in 2 ways. Okay, it destroys lung tissue, which is caused by the obstruction of it, and it causes inflammation and irritation to the airways. All right, that cause the disease to get worse. So that's how cigarette smoke is different, a little bit different. We'll talk about how that's different with lung cancer. All right, any other questions so far? Okay, continuing on here. All right. The next one here is called what they call TB. You might have heard of that before. Tuberculosis is another respiratory illness. So tuberculosis is a disease caused by a bacteria called Mycobacterium tuberculosis, where the name comes from. This bacteria can affect any part of the body, but usually affects the lungs. If not treated, a person who has TB can develop TB disease. If a person develops TB disease and does not get appropriate medical treatment, he or she possibly can die from it, from tuberculosis, TB. So how do you get TB? TB is spread through the air when a person who has TB disease frequently sneezes, coughs, speaks, or is near somebody for a long period of time. People who breathe in the air contain TB germs and become infected with TB. Typically, only close contacts of people who have TB disease are considered to be at risk. Okay? So how is TB infection different from TB disease? There's a little bit of a difference here. People with TB infection have a positive TB skin test, but they are not sick. They don't have symptoms. They cannot spread TB to others. They can develop TB disease if not treated for TB infection. When TB infection is treated, it greatly reduces the chance that you will ever develop TB disease. Okay, any questions so far on TB? All right, here we got a question here on Val. Can cigarette smoking cause asthma attacks too? No, asthma is going to be affected mainly from the obstruction of airway with other agents causing those to trigger an asthma attack. Cigarette smoke will not. Cigarette smoke is going to be it's going to be emphysema or lung cancer, most likely affecting the lungs. Okay, so smoking, someone might get a reaction to it, but cigarette smoke's really not directly related to asthma. Okay, you get secondhand smoke, which we'll talk about that one too when we talk about lung cancer too. All right, so moving on TB. How do I get tested for TB? So there's a TB skin test, and it's performed by injecting small amounts of fluid in the skin on the lower part of the arm. You will need to return with about 2 days or 48 hours, 2 days, to have the like a healthcare nurse look at your arm to see if your skin test is positive or negative. If you get a skin test at your local health department or at your healthcare providers, they can do it right there in the office. If you have a positive reaction to the test, your healthcare professional provider may do other tests to see if you've developed TB disease. Okay, so what are the symptoms of TB? Well, you feel sick, feeling of sickness or weakness, weight loss, fever, night sweats. You'll start sweating at night. TB disease affects the lungs, and additional symptoms include a bad cough that lasts longer than 2 weeks, shortness of breath, pain in the chest, and even coughing up blood are some types of symptoms of TB. Okay. All right, so TB can occur when a person has breathed in TB germ, but the person is not sick. Okay. TB disease can develop in a person with TB infection if they do not get medical treatment. And a person with TB disease is sick, and they may have several symptoms of that disease. If left untreated, persons with TB can die from TB as well. Okay, any other questions so far? All right, we'll continue moving on. All right, how is TB treated? TB disease can usually be cured by taking several medications, 6 to 12 months. All right, it's very important that people who have TB take the medication exactly as prescribed. If you stop taking the medications too, you can become sick again. All right. Also, if you do not take medications correctly, the germs may become resistant to the medications and become more difficult to treat. Okay. All right. Moving on to the next one, lung cancer. I mentioned that one earlier. Lung cancer is the #1 cause of cancer-related deaths in the United States, more than all the other types of cancers, breast cancer, prostate cancer, colon cancer, all of them combined. All right, risk factors, somebody that smokes. About 90% of all cases are people that smoke. Okay, so please don't smoke. I'm telling you, that will help with your health as you get older. Secondhand smoke. About 25% of non-smokers cases are from somebody that's around somebody that smokes, meaning that you're not smoking, but you're around somebody that's smoking often. Occupational and environmental risk factors as well. Maybe a poor air quality in your area. Maybe there's a lot of pollution. That could be also affecting with the lung cancer there too. All right. Some symptoms of Lung cancer, fatigue, meaning getting tired, cough, shortness of breath, chest pain, loss of appetite, coughing up phlegm, coughing up blood. All right, if cancer has spread, symptoms include bone pain, difficulty breathing, abdominal pain, headache, weaknesses, and confusion. All right, so how is lung cancer evaluated? Let's talk about that one next here. All right, so because most patients have a tumor in the lung, a chest x-ray or CT scan of the chest is usually performed. The diagnosis must be confirmed with a biopsy. All right, and the location of all sites of cancer is determined by CT scans. Okay, so and also MRI, so they could find out where the cancer's at. All right, it's important to find out if the cancer started in the lung or somewhere else in the body. So cancers arising in other parts of the body can spread to the lung as well. Okay, so how is the lung cancer treated? Treated on a couple different ways. Surgery, radiation therapy. Okay, if someone getting radiation, chemotherapy, options used to combine drugs. They call targeted therapy. And lung cancer is usually treated with combinations of a lot of these therapies, from radiation and chemo and surgeries. Okay, all right. So I covered some of the basics here on all these different types of respiratory illnesses. You could choose you're just choosing one for this project. Okay, I covered pneumonia, strep throat, flu, common cold, lung cancer, pneumonia, okay, asthma, emphysema. So a wide variety of ones we talked about here. Okay, so your job is to research one, tell me about the symptoms, what it does to somebody, what are the symptoms, what are the treatments, how long will they live, is there a cure for it? So provide as much information in the research that you can to me, along with drawing your diagram of the respiratory system. So I'm going to ask some questions here about the respiratory system, see if you guys been paying attention even from Monday's lecture and from today. So if you would like to type your answer into the space bar at the bottom, it's going to kind of go through some of the vocabulary that you have. Don't forget there's also a brain pop due at the end of the week as well on Friday. Okay. Okay, this is a part of the breathing apparatus. Okay. All right, let's see. Question here before I continue on here. Do we need to turn it in Friday, or we could turn? Oh, you can turn it before. That's fine. I've been getting some projects already, so I've only gotten a few. Okay, but yeah, you could turn them in as soon as you're done with them, so you don't forget about it. But the Friday's the due date. I would usually assign these on Monday, a project or a brain pop, and then give you the week to work on it to get it turned in. Okay. All right. So, can you tell me about this as a muscle underneath? When you breathe, you inhale and you exhale. This is underneath the rib cage. All right. This is a muscle that helps whenever you inhale and exhale. When you inhale, it inflates. When you exhale, it deflates. What is that muscle called? Anyone know? So go ahead and type your answer in there. This is a flat muscle, okay, at the bottom of the cavity of the chest wall, below the lungs, okay, in the chest cavity. It's a flat muscle. Does anyone know what that's called? You could write your answer right on your sidebar. Yes, very good, Val. That's the diaphragm. Good job. So that's one that you could have included, should have included in your picture of your drawing. I'm talking about some of those ones now, your important vocabulary. Very good. All you guys got that. Excellent. Val, Isabella, and Gavin, thank you for partaking in the diaphragm. All right, let me ask you another one here, see how well you paid attention here from the last unit. Okay. These are air. This is air that enters your lungs through a system of pipes or branches. As they come down through the trachea, they go off into branches. What are these branches or these pipes called where air enters your lungs? What are those called? Okay, good job for some of those that answered that. Looks like Chloe, Gavin. Yes, very good. The bronchi, very good. Both of you, Val and Gavin. Fast fingers typing there. You both got that there. Gavin and Val. That's the bronchi. That's those airways that kind of go into the chest. Very good. Isabella got it there too. Very good. So the bronchi are the enters your lungs through systems of pipes or stems. All right, very good. Here's your next one I'm going to give you right now. All right, so this here is where the important work of gas exchange takes place between air and blood. Okay, these were at the end of the bronchi and bronchioles, the branches. This is where gas exchange, carbon dioxide and oxygen. They are small sacs. What are those called? All right, is another important term that was also on your list to put to know where things are at in the respiratory system. Very good, Val. You're the first one to get it. Excellent. I won't reveal the answer yet. See if anybody else knows the answer. You are correct, though, Val. Okay. All right. This is where the gas exchange takes place of the air and the blood. All right, inside the lungs. Okay, Gavin, you got it right. Very good. Chloe, you got it right so far. 3 for 3. Anybody else still? I think you're the only 3 that are participating, which is great. Okay, so Val, all right. Yes, you got it all right. So it was the alveoli. Very good. All 3 of you guys got that. So Val, Gavin, Chloe, nice job. All right. So, all right, let me go through another organ here that we studied. All right, this one here, this was the part of, this is also known as the voice box. It's short, somewhat cylindrical. All right. What is that called? The voice box or vocal cords had a specific name, scientific name. What is that called? We'll type your answer there. The voice box or vocal cords. Those a part of your throat. It's like right in here. What is that called? Not your vocal cords. Very good, Val. You got it. Try that again, Gavin. It's not. This can't be vocal cords. If I'm asking for what is a vocal cord, what it's called. All right, you got it there. You got it. 3. You got it. Chloe, Gavin, and Val. Very nice job. Good job. That was the larynx. Very good. The larynx is the vocal cords right in here. All right, excellent. All right. How about this next one? This is a flexible tube called the windpipe. All right. What is that called? The flexible tube, also known as the windpipe. What is that called? This is a flexible tube, also known as the windpipe. Okay, you got it. Val, good job. Okay, you got it, Gavin. You got it, Isabella. You're close, Chloe. Chloe, you could change that answer. That would be right from the digestive system. Think about the respiratory system. So on that. But Val, Gavin, Isabella, you got it correct. This is another name for a windpipe. It's a muscular tube or a flexible tube. Flexible tube called the windpipe is what? Okay, looks like almost all you got it. I was going to see if Chloe get an extra chance at it, but Gavin, yes, you got it, Chloe. Way to get it back. All you guys got it right. Good job, Gavin, Chloe, Isabella, and Val. Nice job. It's the trachea. The trachea is the correct answer for that one. Good job. That is the flexible tube or windpipe. Good job. How about let's try another one here? I'm just going through different ones. Now we studied the lungs, and we knew that the lungs are conical shaped. All right, and that's the chamber where gas is exchanged there. But we also studied the lungs itself. There in the lungs, the left lung had how many lobes to it? The left lung has how many lobes? Who can answer that one? See if you paid attention from Monday. All right, I don't know where you gotta go, Gavin. So you're exiting the meeting. But how many lobes does the left lung have, to be specific? Okay, you're close there, Isabella. That's not correct, but that's a good try. You're very close. Okay, looks like I see Chloe got the answer. Same with Val. Nice job. Those are both correct. Want to go back and take a look at that. So it's divided into what they say two lobes. The left has two lobes. Okay, it's smaller than the right lung. Okay, it's a little bit smaller. How many does the right lung have? How many lobes does the right lung have? So the left lung was a little bit smaller because it accommodates the heart, where your heart would be. Okay. So how many does the right lung have? How many lobes does the right lung have is your next question. Okay, looks like Chloe wrote and okay, yeah. Looks like you guys have the correct answer. Three. Three is your correct answer. Nice job, you guys. So three lobes for the right lung. Very good. All right. All right, let me go to another one here. I'm just going through some of the parts that we've studied, the diaphragm, the bronchi. Okay. We call this air from the outside environment enters the nose and the mouth through which process? What is that called? When you take in the air from outside, we call that what? What is the name for that? Taking in air from the outside environment. Taking in air from the outside environment, what do we call that? Yes, very good. You guys, all three got that. Inhaling, inhalation. Good job. All three of you guys got that. So inhaling. Okay. What do we call? This is called when gas. The forces of gas are forces gas out of the lungs. So when you're breathing out, we call that what? What's the name for that process called? Breathing out or pushing out that gas is called what? Yes, very good. All you guys got that one there. Good. So exhaling and exhalation, very good. All you guys got that one right as well. Okay, excellent. How about this one here? Another part that you needed to know for the respiratory system is also called the throat. What's another name for the throat? It's found in the respiratory, and we studied it last week in the digestive system. So what is that called? All right, yeah, you guys are doing good. Keep up the good work here. Answer this next one here. You guys got all my questions so far, so good job. All right, so you're paying attention. So what is the back of the throat or the throat called? Just a general scientific name for it. All right, it's that pathway for food and air. Okay, it's not the trachea. We've answered that one earlier. Yes, very good. Val, you got it. I'm waiting to see if somebody else got it. Gets it? Okay, Chloe, you got it. Nice job. Okay, and it looks like Vicente got it too. He joined in as well. Okay, So yeah, good job you got 3 answers that are correct there. It's the pharynx. Very good. So the pharynx is the correct answer for that one. Nice job on that. All right, excellent. Okay. All right, how about some things? I'm going to go over some things for today. I'll go over a couple of different types of diseases and their symptoms to see if you get the right disease. Okay. All right, so here we go. This is a chronic lung disease that obstructs airflow. So it involves difficulty breathing, inflammation and swelling, and there's mucus lining the airways, and it's the tightening of muscles around those airways as well. What's that called? This is a chronic lung disease that obstructs airflow. It involves difficulty in breathing due to inflammation or swelling, mucus in the air, and then tightening of the muscles around the airway. Very good. Val got it. Looks like Isabella got it. Nice job. Yep. Looks like Vicente got it. Nice job. All right. It is asthma. Good job. Asthma is the correct answer for that one. Nice job. All right. Let's try this next one here. This is inflammation of your larynx, which causes a hoarse voice or loss of your voice. Remember, it affects your vocal cords or your voice box. What is that one called? What was the name of that illness that affects your larynx? Give that one a try. It says a respiratory illness that affects your voice box right here. Okay, your voice box for talking. You see some people lose their voice. What is that one called? It's a hard one to spell out. I don't expect you to have the spelling correct. It says a respiratory illness that affects your larynx or your voice box. What is that called? I talked about it earlier in today's lesson. Okay, let's see. Okay, do you know it, Vicente? Veril says pneumonia. No, it's not pneumonia. Yeah, Chloe, you got the correct answer on that. Okay, this is an illness that affects your voice box, your upper respiratory part of your upper respiratory system. So when people lose their voice, affects their vocal cords. So Chloe got it correct. Very good. So Vera, want to try that again, or Vicente, or Isabella, and Val? Val, you got it correct. Very good. Good job, Val, and Chloe got it correct. All right. Okay, I'm going to give you the answer on this one. All right. Okay, it is laryngitis. Very good. Okay. Laryngitis is the correct one for that. All right, so good job. All right, let's take a look at the next illness here, respiratory illness. See if you get this one. This is another type of respiratory inflammation of the main airways passages to the lungs. It usually happens in the winter months. Okay. Um, you get slight fever, chilliness, back pain, sore throat. You need to drink plenty of water. Take fever reducers to help for the treatment. The patient usually needs to rest until the fever subsides. What do you think this one is right here? It affects the main air passageways. It kind of goes along with laryngitis. So your main pathway is up your trachea through your bronchioles, your bronchi. So I'm giving you a little bit of a clue there. Yes, very good, Chloe. Very good, Isabella. You got it. Val, that's close, but it's not the flu. You're pretty close there. It's not the flu. They call that, but Chloe and Isabella got that correct for that type of respiratory illness. All right, you got it now, Val. Good job. Way to come back and get that. Good job. You guys got the correct answer. It's bronchitis. Good job. Bronchitis is that one. All right, I'll probably go through maybe one more. No, it's not coronavirus. We're not going to talk about the coronavirus till the end of the year because that's more viruses than respiratory illnesses. So we'll do bacteria and viruses towards the end of the year. So we will talk about more of the coronavirus as we're getting more information on it. So, but it does kind of have effect with some things that are happening with in our society right now. All right, your last question here that I have, then I'll open it up to you if you have any questions because I'll be signing off soon and your projects are due on Friday. So your questions are, your last question is, this is a type of bacterial infection of tissues in the back of your throat and the tonsils, and the tissues become irritated and inflamed, causing sudden, severe sore throat. What is that one called? It's a bacterial infection of tissues in the back of your throat and your tonsils, and the tissues become irritated and inflamed, causing sudden, severe sore throat. Very good. You got it, Chloe? Yep, you got it, Isabella? Nope, it's not that. It's not tonsillitis, but that's Chloe. You had it right the first time. Your first answer. It's not tonsillitis. We'll try that again, Val. It's something that Chloe mentioned that she had 5 times earlier in this segment when we were talking. Okay, you got it now, Val. So Val, Isabella, and Chloe, all 3 got that correct. That was strep throat. Very good. Strep throat is a respiratory illness as well. So good job on getting that correct. Okay. All right. Do you guys have any questions before I sign off for today, since we're getting close with time? And when I went through the review with some of you guys there. 2 things that are due on Friday. Your main project is the project of the diagram of the respiratory system and the parts and what they do, labeled, along with a research of the respiratory illness, some of the ones that we've been covering today that you can find information on. Tell me what the illness is, what it does, how it's treated, what are the symptoms, and what can happen to somebody with a life expectancy. Is there a cure for it? Maybe not. So tell me as much information as you can on your research there. And then lastly would be your brain pop due Friday, because I'm not back on here for another live stream for 6th grade this week right now. Okay, so make sure you have plenty of time. You have 2 days to get this into me. So does anyone have any questions, comments, concerns about the respiratory system? All right, thanks, Val. Thanks for partaking. Thanks for asking that, helping out with the review. All right, I'm glad to help. I'm glad to communicate with you guys. So, tune in to me. I'm usually here at 8:30 to 9:30 on Mondays and Wednesdays, and then 1, 2, and I also do a 5 to 6 on Monday. So Mondays and Wednesdays are the days for 6th grade science. So always stay tuned for a video from Mr. Candelou and I as well, along with the live lectures on our topics here on the respiratory systems this week. Well, thank you too, Isabella. Thank you for partaking. And thanks, Chloe, as well. Chloe and Isabella and Val, thanks for all partaking in the review. So again, get project stuff turned in as soon as you can. You can turn them in any time. I'm always checking my email, so as long as they come through. You could sign off at any time too, since we're getting close for today. Any other questions? Okay, yeah, today or tomorrow is fine, Val. You can turn it in today or tomorrow, however you want to do it. You can always email it to me or send it through Teams, however is easy for you. I check both. So good job for keeping up and staying on top of your work and what's due. All right, Veryl, thanks for partaking in lesson today too. Also, did I go to, yes, you did very well. Nice job, Val. You're doing good. You're keeping up with all your work on your projects, so good job. So you did well on the digestive system one, so good job. Yep. So keep up the good work. Good job. Okay, if there's no other questions, like I said, you could sign out for today. And I will be back on, like I said, next week. You have the rest of the week to get this stuff turned into me. So the best way to communicate is through email or Teams. So send me a message on there if you need to. So I'm going to sign off for today. So good job for those partaking. So thanks, Farrell. Thanks for being here too. Okay. All right. And have a good rest of your afternoon and try to stay dry. It's raining really hard right now. So hopefully all you guys are safe too. All right. Signing off. So have a great rest of your week and good luck with the project. Get them turned in as soon as possible. It's let me see, Val. Brain pop's part of the grade, but it's not as large part of your grade, but it is part of your grade. So yeah, keep doing the brain pops with those. Okay. Yep. All right. So good job. All right. Good job, guys. Have a good afternoon. All right. I'm going to sign off for now. So have a good day. All right.